Before we begin, make sure you subscribe to this channel for clear, medically grounded guidance on nerve health, circulation, and aging well, because the earlier you act, the more nerve function you can protect and restore. As a urologist, I need to tell you something important. If you have diabetes and numbness in your feet, your nerves may already be sending distress signals that you cannot feel. This numbness is not harmless. It is one of the strongest predictors of ulcers, infections, and amputations in older adults. But there is hope. In as little as 7 to 10 days, many patients begin noticing early signs of nerve awakening when they give their body the right tools to heal. Nearly half of people with diabetes develop peripheral neuropathy, and foot numbness is the most dangerous form. Pain is protective. When sensation disappears, cuts, blisters, or pressure injuries go unnoticed. Infection develops quietly. Tissue damage spreads. This is how thousands of amputations happen each year, not suddenly, but slowly and silently. Let me explain what is really happening inside your feet. Diabetic neuropathy is not caused by high blood sugar alone. It is a perfect storm of 3 destructive processes attacking your nerves at the same time. First, chronically elevated glucose forms toxic molecules called advanced glycation end products, or AGEs. These compounds act like rust, slowly corroding delicate nerve fibers over months and years. Second, chronic inflammation surrounds your nerves like a heavy blanket. When blood sugar remains elevated, the immune system releases inflammatory chemicals that damage nerve tissue and restrict circulation. Blood flow becomes sluggish, and nerves are starved of oxygen and nutrients they need to survive. Third, and most critically, the myelin sheath begins to break down. Myelin is the protective coating around each nerve, similar to insulation around an electrical wire. When myelin deteriorates, nerve signals cannot travel properly. Sensation fades, starting in the toes and gradually moving upward. Here's what most people are never told. Conventional treatments rarely address these root causes. Pain medications, nerve stabilizers, and topical creams may reduce discomfort, but they do not rebuild nerves. Without sensation, small injuries escalate, infection spreads, amputation becomes a real risk. But there is another approach, one that targets inflammation, circulation, and myelin repair at the same time. That approach begins with food. Let me introduce the most powerful foundation food for diabetic nerve repair: ground flax seeds. I understand the skepticism. They seem simple, even ordinary, but the science behind them is remarkable. Flax seeds are the richest plant source of alpha-linolenic acid, a critical omega-3 fatty acid. Myelin is largely made of fats. When you consume flax-derived omega-3s, your body uses them to rebuild damaged nerve insulation. In clinical studies, diabetic patients consuming 2 tablespoons of ground flax seeds daily experienced significant improvements in nerve conduction speed. Many reported tingling in toes that had been numb for years. That tingling is not damage, it is nerve reactivation. Flax seeds must always be ground. Whole seeds pass through undigested. Grind weekly, store in the refrigerator, and begin with 1 tablespoon daily before increasing to 2. Next, fatty fish. While flax provides building blocks, fatty fish deliver EPA and DHA, the most biologically active omega-3 fats. These integrate directly into nerve membranes, improve flexibility, reduce inflammation, and activate genes responsible for nerve regeneration. Diabetic patients who consumed fatty fish 3 times per week showed over 40% greater improvement in nerve function compared to those who did not. Prioritize wild salmon, sardines, and mackerel. If fish is not an option, choose a high-quality fish oil providing at least 1,000 milligrams of combined EPA and DHA daily. Third, dark leafy greens. Spinach, kale, and collards are rich in alpha-lipoic acid, one of the most powerful antioxidants for nerve protection. Alpha-lipoic acid penetrates every part of the nerve cell and helps regenerate other antioxidants. German physicians have used it for decades to treat diabetic neuropathy. Studies show improved nerve conduction and reduced burning and numbness within weeks. Aim for 2 to 3 cups daily, rotating varieties. Fourth, walnuts. Walnuts combine omega-3s, vitamin E, polyphenols, and L-arginine. L-arginine converts to nitric oxide, which widens blood vessels and improves circulation. Better blood flow means more oxygen and nutrients reaching damaged nerves. Just 1.5 ounces daily has been shown to significantly improve vascular function in diabetics. Store walnuts refrigerated to protect their oils. Fifth, turmeric. Turmeric contains curcumin, one of the most studied anti-inflammatory compounds in medicine. Curcumin blocks inflammatory pathways that actively destroy nerves. Clinical trials show reductions in neuropathic pain and measurable improvements in nerve signaling. Always combine turmeric with black pepper and healthy fat. Without piperine, absorption is poor. Golden milk before bed is an effective option. Sixth, berries. Berries contain anthocyanins that cross the blood-nerve barrier and protect nerve tissue from oxidative damage. Despite natural sweetness, berries stabilize blood sugar and improve insulin sensitivity. 1 cup daily improves peripheral nerve function. Frozen berries are just as effective as fresh. Seventh, avocados. Avocados provide monounsaturated fats, fiber, potassium, and essential B vitamins. Vitamin B6 supports neurotransmitters. Vitamin B12 maintains myelin. Folate aids nerve repair. Half an avocado daily improves circulation and nerve resilience. Eighth, legumes. Beans, lentils, and chickpeas blunt blood sugar spikes, the primary driver of nerve damage. They are rich in magnesium, zinc, and folate, all essential for nerve signaling and myelin production. Aim for 1 cup cooked daily. Ninth, garlic. When crushed, garlic forms allicin, which improves circulation, reduces inflammation, and protects nerve cells. Let crushed garlic sit 10 minutes before use to maximize benefits. 2 cloves daily have been shown to improve nerve conduction and temperature sensation. Now let me tell you how to combine these foods into a simple daily routine. In the morning, prepare oatmeal with ground flax seeds, berries, and walnuts. Mid-morning, drink a smoothie with spinach, avocado, berries, flax, and unsweetened almond milk. At lunch, eat wild salmon over dark leafy greens with chickpeas, walnuts, olive oil, lemon, garlic, turmeric, and black pepper. Snack on berries and walnuts in the afternoon. For dinner, prepare a bean and vegetable soup with garlic and leafy greens added at the end. In the evening, drink golden turmeric milk before bed. Most people notice early changes within 10 days. Tingling, pins and needles, or warmth in the feet are positive signs. Over weeks, balance improves and pain decreases. Over months, protective sensation often returns. Consistency matters. Nerves heal slowly, but they do heal. Continue medications as prescribed, inspect your feet daily, stay hydrated, walk regularly, manage stress, prioritize sleep because nerve repair happens during deep sleep. Your foot numbness does not have to define your future. Nerves have remarkable healing potential when given the right environment. These foods rebuild myelin, reduce inflammation, improve blood flow, stabilize blood sugar, and protect nerve cells. Your feet carried you through decades of life. Now it is time to give them what they need to heal. Start today. Stay consistent. Trust the process. Your nerves are ready to wake up.